Hi, my name is Pooja, and the clinical question of my interest is, despite the numerous benefits, why do some mothers stop breastfeeding their newborns? Even though there are many benefits to breastfeeding, there are many uncontrollable factors that contribute to early cessation. According to CDC.gov, 60% of mothers do not breastfeed as long as they intend to. CDC.gov 2022. Factors that affect decision making include issues with lactation and latching, concerns about taking medications while breastfeeding, concerns with infant nutrition and weight, and unsupportive work policies and lack of parental care, CDC.gov 2022. Additionally, social aspects like cultural norms surrounding breastfeeding affect decision making as well. Lack of support from families, friends, healthcare professionals can cause mothers to stop breastfeeding early or not start at all. Personal issues like body image, lack of confidence, chronic conditions like diabetes, lack of education, and financial issues can lead to insufficient resources, which decreases chances of breastfeeding. This is the first map created, and it shows how all these factors contribute to the mother's decision of early breastfeeding cessation. And breastfeeding provides many benefits for both the baby and mother. Breastfeeding can reduce the risk of chronic conditions like asthma for newborns and reduce the risk of breast cancer, ovarian cancer, and cardiovascular problems for mothers. Scheme et al. 2023. Unfortunately, in the United States, breastfeeding rates have declined over the years, with only 24.9% of infants being breastfed completely through 6 months. CDC.gov 2022. What evidence-based strategies address the clinical question did you discover? From the research that I did, I found that the most important thing mothers need is support in their professional and personal lives. The research articles included randomized control trials and systematic reviews that focused on improving workplace policies and different ways to support breastfeeding mothers. Without adequate policies, women in the labor force and their babies will keep facing inequalities in terms of infant nutrition and employment choices, and the right of women to combine motherhood and professional development can be jeopardized. Villar-Compton et al. 2021. Additionally, I learned how peer support groups are one of the most effective ways to help breastfeeding mothers continue and not stop early. Describe the theory that you chose and why it's appropriate to address the clinical question. A theory that would help address the problem is Swanson's theory of caring. The purpose of this theory is connecting caring processes and healing experiences that will provide desired health outcomes. Smith 2020. For example, when a provider takes time to get to know, be with, and maintain belief in patients, patients feel a sense of healing and wholeness where the patient feels understood, valued, safe, capable, and hopeful for the future. Smith 2020. Swanson's theory of caring can help mothers build healthy relationships with their healthcare providers, which can help them feel more confident in obtaining their breastfeeding goals. Miller and Wachner 2019. The theory consists of guidelines for healthcare professionals to utilize and provide patient-centered care to breastfeeding mothers and infants. Miller and Wachner 2019. In addition, it can help provide encouragement to breastfeeding mothers and reduce contributing factors associated with early breastfeeding cessation. This is the final concept map that I made, and the theory-informed conceptual model provides a visual of how Swanson's theory of caring can reduce contributing factors by positive healing responses from the mothers. In the center of this model is the outcome of how Swanson's theory will help healthcare professionals provide patient-centered care to breastfeeding mothers and infants. To help achieve this outcome, there are different aspects that can reduce the contributing factors and lead to positive feelings for mothers during the healing process. The first aspect of being with describes how access to professional support increases recognizing and honoring emotions of breastfeeding mothers, which increases breastfeeding rates. The next aspect of enabling describes how access to breastfeeding education and information increases duration of breastfeeding and breastfeeding initiation rates. Knowing about breast milk benefits like professional education can help healthcare professionals expand their knowledge on how to support mothers during this process. The next aspect of doing for explains how peer support groups, support in the workplace like from colleagues and supervisors, and support and caregiving services increases mothers feeling supported and motivated to continue breastfeeding. The last aspect of support from spouses is an important factor that can increase continuity of exclusive breastfeeding. All these interventions can help achieve the breastfeeding mother's healing response of feeling hopeful, capable, valued, understood, safe, supported, willingness to initiate breastfeeding, motivated to continue breastfeeding, and decrease maternal stress and reduce risk of postpartum depression. The biggest aha moment was learning about the importance of using theories and practice, especially Swanson's theory of caring. Swanson's theory of caring can help healthcare professionals provide patients under care by understanding which contributing factors are affecting the specific patient, finding available resources to increase breastfeeding rates, and provide education about benefits of breastfeeding. The main takeaway from this presentation is the importance of theories, especially in the nursing profession. Theories and clinical practices help build therapeutic relationships and effective communication between providers and patients, which lead the desired outcomes and provide better patient-centered care. Another thing would be advocating for breastfeeding, like in professional settings, as well as encouraging continuation of breastfeeding, whether in practice or in personal lives.